Hello and welcome back to the KCCMH Connection. I'm your host Eileen, and today we're talking about one of the topics we hear about most, hospital billing. We know billing has been a source of frustration for our patients for a long time, and it's something we're actively working on to improve through new staff, additional training, updated processes, and hopefully in the future a new electronic health record system. So to help us better understand how billing works and what changes are happening, we're joined today by our new Revenue Cycle Director. Today we'll learn what she does, follow the life of a medical bill from start to finish, and talk about how patients can better understand their bills and advocate for themselves when something doesn't seem right. Hello, Danielle Magera.
Yes.
Welcome to the show.
I'm excited to be here.
Cool. So, Danielle, can you tell us a little bit about yourself and what brought you to KCCMH?
Yeah, so I've worked in healthcare revenue cycle for over 30 years in hospitals, specialty practices, and large healthcare organizations. Throughout my career, I've always been really passionate about improving the patient experience overall, because billing and registration are often the last thing that patients think about after receiving care. When the opportunity came to join the hospital, I saw an organization that genuinely wanted to improve. I have an incredible team that cares tremendously and deeply about our patients, and I knew that this was an opportunity to build processes that support both our staff and our community. I'm excited to be a part of that journey.
Yay! So what is a Revenue Cycle Director, and what does the role oversee?
So simply put, my job is to make sure that everything that happens behind the scenes when you come to your visit with all of your insurance and your billing and your codes and your claim that gets sent to your insurance is all correct. I want to make sure that patients receive care and make sure that the hospital's paid for the care that they deliver. That starts before a patient ever even walks through the door. With registration and insurance verification, it continues through coding and billing and ends when the claim is processed correctly and the patient receives a bill if they have a balance. It's really about creating a smooth experience from start to finish.
Why did you choose a career in healthcare finance?
I have always enjoyed complex problems, but what keeps me in healthcare is knowing that every improvement we make directly impacts patients. If we can simplify billing, reduce any of the confusion that patients are having, and eliminate unnecessary delays, we've reduced stress for somebody who's already going through so much in their lives.
Yeah, so, at this hospital, and I would assume many others, but, my experiences here is that billing has been just like a thorn in the side of many of our patients, and so I'd really just want to understand why. But first, can you tell us what improvements are underway?
Yeah, so the first thing we did when I got here is we took a step back and evaluated our current workflows. Before making any changes, we needed to understand where our opportunities lie. That evaluation led us to develop a comprehensive patient access training program that our registration team is currently completing. We're already into our third week of specialized training. But the goal isn't simply just more training. It's giving our staff the knowledge, confidence, and tools they need to get things right the first time. We're also preparing for one of the biggest projects our organization has ever undertaken with the implementation of Epic, the electronic medical record system that you mentioned. Preparing our staff now means we'll be ready to provide an even better patient experience when the time comes.
So what is implementing Epic? What's that going to mean for our patients and community?
Well, it's going to mean that we have been operating on the current electronic medical record system, TrueBridge, for quite some time now, and it's dated, it's archaic. While it gets the job done, it's not the bells and whistles of our competitors. And so what it's going to do is it's going to move us into the next generation of healthcare. It's going to allow us to collaborate better with other hospitals and clinics in the area, because if they're on the platform, you can automatically receive your medical records in real time that you've had with that clinic. And so there's a sharing of information that will be great for patient care. I think it will improve the way we store our documentation. It will improve the way that visits are put in, the way that we can move into using AI and things like that. I think that it's going to just open us up into a more modernized version of the electronic health record, which has been long overdue for the hospital.
And you're familiar with Epic? You've used that in your previous facilities?
Many times.
And so, can you tell us, is it worth it?
Oh, yes. I think, as a matter of fact, when they offered me the job, my first question was, what EMR system do you work with? Because there were a few that I was going to hang up if they told me. but Epic was definitely a deal for me. Like, it's a great system. It is very modernized. We're receiving the top of the line version of it, and I think it's going to modernize things, and it's going to make things so much easier for patients understanding their bill, for bills getting billed to the insurance correctly, and being able to just have a lot of those things at our fingertips that we haven't had before.
So we talk about moving towards Epic. Do you know why it takes so long for us to implement a new system?
Yeah, so we have to, first of all, take care of all the things in the old system that need to be cleared up. That involves doing our last go at trying to get revenue in for things that we can maybe appeal or things that maybe shouldn't have been denied in the first place. Wanting to clean that up. And then another thing that we need to do is we need to go through our charge master, which is the back end grid of what we charge for everything. We're going to do a review, make sure we don't have any old codes in there that we don't use anymore, because the codes always change. And then also making sure that we are in comparison with our competitors for what we charge for services.
Gotcha.
Doing all of that takes time.
Mm-hmm.
And so we want to make sure that we take the time to do it, because good information in is good information out. We want to set ourselves up for success.
Yeah, I've heard you say that multiple times, and what do you mean by that?
It means that while Epic is Epic, it's only as good as the information that we put into the system. And so we want to make sure that when we're starting brand new, all the information that we're putting in is good, that we don't have any old clunky codes that we're not going to be using anymore, any outdated codes, that we're not charging what we charged for back in 87. We want to make sure everything is shored up and ready to go. And it's all good information, so that when we put our information in, we get good, clean claims out.
Excellent. And so I know you talked about your training system. We just mentioned Epic, but what are your biggest goals for your billing department over the next year?
I feel like my biggest goal is restoring confidence in the billing experience. Patients deserve clear communication, accurate registration, timely statements, and answers when they have questions. Success isn't just measured by financial numbers, it's measured by patients telling us that was easier than I thought it was going to be.
And just also to kind of clear up, it's not that anything was wrong here, right? It's just that our systems needed updating and...
Correct. Healthcare is I like to compare it to a living being. I mean, it's constantly evolving, it's constantly changing, it's never stagnant. The landscape is always different. And so it's not unusual for a hospital to go so long with their current EMR and with their current processes and then pivot when things change. And especially when we start looking at things like the way Medicare pays for claims, the way they evaluate claims, it's necessary to make those changes and to get more modernized, and then also to be able to share information in the rapid landscape and timely. I mean, back in the day when you tried to get medical records, it took days for them to bring them to you. And so being able to have those in real time will be able to allow our physicians to make very good medical decisions based on the current statuses of their patients.
Yeah, especially here where we have so many specialty providers that come in. A lot of their departments or their companies already use Epic, right? So
Correct.
If they're on Epic and we're on Epic, will their information mesh together in a patient portal?
Yes.
I love that.
Yes, and if you've had an Epic profile already, like say you went to a hospital in Denver or you went somewhere in a big city and they used Epic, when they bring you up, like they'll be able to transfer like the majority of your patient information over, your demographic information.
That's
it will
excellent.
still need to be verified by us, of course, but the basic nuts and bolts of your profile will come over.
Wonderful.
Yeah.
Okay, walk us through what happens after a patient leaves their appointment. Is that when billing starts?
Well, it actually starts before that, because
Okay.
before a patient comes in, we're laying down the groundwork. Like my team is getting authorization for your visit. So say you're coming in for like a DEXA scan. We've already contacted your insurance company with the order, let them know that you plan on having the DEXA scan and made sure that your insurance is something that your insurance is going to cover. So, and then we've also verified your benefits, because we want to make sure that we're doing our due diligence to make sure that you do have active insurance. But once a patient leaves, so say you've had your DEXA scan and now you've left, the provider completes the documentation. So they'll go in and finish their charting. A coding specialist reviews the medical record, and the claim is prepared to submit to the insurance company. Once insurance processes the claim, so once they receive the claim and they pay it according to what your benefits are, they send us what's called an explanation of what they paid and what remains the patient responsibility if there is some. After that the process is complete, do we send a patient statement. So we only ever send a patient statement once that process has completed, the complete circle.
Okay, and so this is, I think, right where people get into trouble is if they don't give you updated insurance information.
Correct.
Or if something, maybe an address changes. This is sometimes where bills and payments or insurance can get caught up.
Yes, and this goes back to good information and good information out. So when a patient gives us their insurance information, all we know is what they've given us. So we then use that to bill through the insurance. If it's not active or they've had a lapse in coverage and we're not aware of that, that halts the claim right there while we stop and figure out, do you have other insurance? Is this going to be self-pay? Who's going to be responsible for this bill? And that takes some time to figure out. And then we have to either update it and rebill it to the correct insurance, or, take the adjustment and then bill you, like whatever it is that we need to do. So yeah, I think probably one of the biggest things is that just bearing in mind that like we only have what you give us.
Right.
And so if it's not correct, then of course your claim's not going to make it out the door, because their clearinghouse will stop it and say you're not eligible. So having, make sure that you're up on your insurance and stuff like that, and paying attention to your cards. And when you get new insurance, make sure that you're telling the team downstairs so they know to update your profile in the system.
So is that why every appointment they verify your address, verify your insurance, and people are like, but I was just here.
Yeah.
And it's just to keep the information fresh.
Yes, it's to make sure that we have the right information. Also, we're human, so it's to make sure we didn't maybe make a typo, or you told us it was United Insurance and we thought United Healthcare and it was really United American. I mean, it's just that safety check that we do, because one safety check in the beginning can make sure your claim goes through all the way to the end, where if we didn't do it, it could stop there and we wouldn't know until we received the denial.
Yeah. So I know you mentioned insurance, but at what point does insurance get involved?
So insurance becomes involved almost immediately. Like I stated, ideally we've already verified your benefits before your appointment, and after your visit we submit the claim electronically for processing. So insurance is involved throughout the whole process.
Okay. So that's, again, why we have to...
Exactly.
Because we always talk about on this show what our customers can do to help themselves have a better experience. And so them bringing their most up-to-date insurance cards and verifying that what they give you is accurate is going to help them.
Yeah, one of the easiest ways patients can help us is by coming in prepared. Please bring your driver's license or state-issued ID card, your current insurance cards, and if your visit is related to an automobile or work accident, please bring that claim information as well. And then if your visit requires a referral or physician order, having that available also helps. Providing accurate information at registration helps us submit your claim correctly the first time, which reduces delays in billing issues.
Okay, speaking of delays, why does it sometimes feel like it takes weeks to receive a statement?
I'm sure, right? Insurance companies each have their own processing timelines. We also want to make sure the claim that has been processed correctly before sending a bill. So that helps reduce confusion and prevents patients from receiving inaccurate statements. I know that most recently we did do like a evaluation of our previous statement, like the company that handled our private pay and our statements, and found that there were some deficiencies. And so we've recently made an alliance with a new company. Statements are now beginning to be sent out, and those statements are being reviewed by a real person in real time to make sure that they are right, they are accurate, and that we're sending you the most updated information that we have.
So speaking of that, that's kind of aligning with our recent social media postings or newspaper ads talking about if you receive a text message from the hospital that says, this is Carson County Memorial Hospital, you have a statement available, that's us, right?
Correct.
And that's caused another kind of delay in billing, right? Moving from the old...
Yeah.
This old...
Yes, the
biller?
Old... Yeah, well, the old... it's called an Easy Out company because they do like payment plans and stuff. Moving from them to the new one did cause a delay, and then wanting to make sure that we're giving the most accurate information. I know that there had been issues before where statements were sent out that weren't the most accurate information, and so wanting to be sure that we deliver to the community the most accurate statement. I mean, we have to get this right. We can't keep saying, this is your statement now and it's wrong, and this is your statement now and it's wrong. I mean, at some point in time, it starts to affect the community. It starts to erode the community's trust in us and their belief that we even know how we're handling their insurance. And so wanting to make sure that we crossed our T's and dotted our I's and got like the most accurate statement that could go out to patients was something that was very important to us. So that did take time.
Yeah, and I think we mentioned this, but we have partnered with a very experienced person in medical coding and billing, and she is going through every statement and making sure that it's being billed correctly, coded correctly. Is that right?
Yes, making sure that like if the insurance sent out an EOB and didn't pay something, it doesn't get pushed to patient responsibility if it shouldn't be, or vice versa, like making sure we didn't take a contractual when it was really patient responsibility. Just really like following along with the EOB and mapping it up with how the claim was processed and making sure that all of those things are correct before a statement is.
Oh, I'm sure that's a lot of work.
It is, but you know what? It's part of our commitment to ensure that we're giving the accurate information to the community and that to restore the trust, and so that they can also feel comfortable about the payments that they're making and the bills that they have.
Yeah, that's great. And I know, sometimes people have this idea that so-and-so is not paying because they just don't want to pay their bill. But I don't think that's true. I think what happens here is that our community has received bills that had errors for so long, or felt like they did, that they know they have a bill to pay. They just want to pay what they think is honest and fair and true and accurate. Correct.
And as a revenue cycle director, I don't look at it when I look at the self-pay balance. So these are just patients that don't want to pay. I also, this brings us to, I think this is a great segue, if I may, into something else where, we have payment plans. Mm-hmm. We set up payment plans. We have a program that can help you if you cannot pay for your bill. My best advice is just don't be afraid to ask. We're here to help you. We're not, one of the biggest misconceptions is the hospital only cares about money. We just want your money. We care about our community and we care about our patients. And we want to make sure that if you are struggling to pay your bill, or you have questions about your bill, or, I'm afraid that I'm not going to be able to pay it, please reach out and talk to us, because that's what we're here for. And we will help you. We'll walk you through it. We'll figure out a plan that's feasible for you and that is attainable for you. Mm-hmm. And then, so there's no reason to worry. Like, we're here to help you.
Yeah. So what kind of payment plans do you offer?
So we have several. We have payment plans that are based on financial measures that you have to meet. We also have a payment plan. Well, it's not a payment plan, but if you pay your bill early, in one balance, you can sometimes get a discount. Mm-hmm. They have all sorts of things. They also, anytime a patient just couldn't pay their bill and just said, they would be willing to work out like a fair, what they agreed was fair for them, and then set up payment arrangements from there on out.
So if somebody gets a bill and they just feel like they can't pay it, they should have no fear of judgment or anger or bitterness. Just come in and talk to us and we will help you make it right.
Correct.
I love that. Okay, so let's go a little bit more about understanding a bill. What is the difference? Because there's so much language in hospital billing, and everybody's insurance is different, but what's the difference between a hospital bill and an explanation of benefits, which I know is also sometimes called an EOB?
Correct. So an explanation of benefits, or EOB, is not a bill. It is simply your insurance company explaining how they processed your claim.
So the EOB comes from your insurance company?
Yes, it comes from your insurance company, and it's the breakdown of this is how much your doctor billed us, this is how much your benefits allow for payment of that claim, this is a contractual adjustment we took if we're participating with your provider, and then the balance is either paid in full, or maybe the remaining balance is your copay or your co-insurance or some remainder of your deductible. But that explains how it was processed. Those come to both the patient and to us, so that the patient knows how their insurance was processed and so that we know how their insurance was processed. Those also get sent to secondary insurance if you had a secondary, so they know how much is remaining that wasn't paid by the primary. If you don't have a secondary, then the next thing that comes is your hospital statement. Okay. That's the bill. That's sent by us, and that tells us what remains after the insurance completed processing.
Okay. So on a statement, what should patients look for when they receive one?
So they need to make sure that their name, insurance, and dates of service and service received are accurate. So you're going to want to look at your bill, and you're going to want to make sure, first of all, is this me? Was I the patient? Number 2, was I there on that day? Like, did I really have a DEXA scan at the hospital on July 3rd? Was I really there? And then also, did they bill my correct insurance? It'll tell you who we sent, because the explanation comes, it will say who paid or who denied. Okay. You're going to want to make sure that we billed your correct insurance. If none of those things are correct, or even one of those things are not correct, you need to contact the hospital and let us know.
Okay. And who do they contact at the hospital?
They can call they can just call the general number and ask to speak to someone in registration, or they can ask for me. My name's Danielle Magera. I can help them. Anybody in patient access can help them.
Okay. So why can two patients receive the same service but owe different amounts? Let's say we both got a DEXA scan on July 3rd and mine cost $125 and yours cost $50.
Well,
also, those are made up numbers. I don't know how much a DEXA scan
I'm
costs.
going wild. We're going to have everybody coming.
No.
I'm just joking. That's just, you're hypothetically.
Yes.
Because every insurance plan is different. Different deductibles, different co-pays, different insurance, and different negotiated contracts that we have with those payers also all affect that. And also your personal benefits. I mean, you may come at a time where you've already met your deductible. Like, say you had surgery early in the year and now you're getting this DEXA scan and you've already met your deductible. Mm-hmm. So of course they're going to pay more because you're going to have a less balance. So it's just all of those things like determine what's paid and what a patient owes.
So there's really no two things the same.
No, it's so situational. It's very situational.
Mm-hmm. Okay. And now that we're talking about imaging and billing, let's talk about that for a second. Why do I sometimes get a bill from somebody else if I have an x-ray here or a MRI?
Because you receive the facility bill for coming to the hospital and having your...
That's what we send out,
Yes, that's what we send. The bill for coming to the hospital and using our equipment here to have, let's say, an x-ray. Then there's also a pro fee, which is the professional fee for the individual, usually a physician or a provider, who interpreted the results. So, like with the DEXA scan, you'd have the equipment and the fee for coming to the hospital, and then the person who read your DEXA would also get paid, because everybody has to get paid for their piece of the pie in delivering the care.
Yeah, and I think this is a good example because let's say, for example, I go somewhere like Children's, I don't receive a secondary fee from them because they have a radiologist on staff that reads the bill that's part of my initial payment. We're a small facility. We don't have a radiologist here.
Correct.
We have rad techs that run the machines. Mm-hmm. And so our payment goes towards that, right?
Correct.
So we have to send the images to a radiologist and they don't bill us, right?
No, they bill the patient separately. They do their billing and they send the bill. So that's why, and sometimes in the ER too, you'll get the ER visit, and then you'll also get the ER physician's visit, and then if you had to have anesthesia, say, you'll get the anesthesiology visit, and then, it's all broken down because everybody, it wouldn't be fair if just the hospital got the money and then the anesthesiologist didn't, and you know what I mean? Yeah, they all have to get paid. So you'll see different providers on your explanation.
Yeah, okay. So again, it's just so complicated because if for instance, you came in for in the emergency room, you will get a hospital bill, an emergency provider bill, and
Correct.
If you had some sort of imaging, possibly a radiology bill.
Correct. Or if you had, to have anesthesiology, say you had to be put out to fix your arm because you broke it, then you'd receive a bill for that as well.
Okay, so it's very complicated.
It can be, yeah.
But if people have questions, it's okay for them to call and ask.
Yes, please do. I mean, yeah.
Okay, so if something doesn't look right, who should the patients call first, the hospital or their insurance?
I would say start with us. Our billing team can often explain what happened or determine whether something needs to be corrected. If we need you to contact your insurance company, we'll then say, my recommendation would be that you call the number on the back of your card, mm-hmm. and then they might be able to give you some further information. But I think, since we're the ones who put the charges in, and this is where you had your service, my recommendation would be that you start here.
Okay. What information should patients have before calling us?
They should have their name and their date of birth, or their medical record number. If they have it, sometimes a lot of people just call and say, I'm so-and-so, this is my date of birth. We can look it up either way. And then maybe if you have received an explanation of benefits from your insurance, it would be wise to have that with you on the call so we can walk through it together.
Okay.
And then if you already have spoken to your insurance company, which is fine, maybe the name of who you talked to, what they told you, and if there's anything that we need to do to correct it. And then, or any new information that we don't have correct. So if we have your wrong insurance, please have your right insurance card available on the phone so you can give that information too.
So let's just say I don't really like talking on the phone. Can I bring all of those things in?
You sure can.
And we can...
Yeah. You just have to wait for one of the registration gals to have it not be helping someone, or you can talk to me, and they would update that for you as well.
Okay, wonderful. So what are some billing issues that can actually be corrected?
So there are a lot of things that can be fixed. If you have the incorrect insurance, we can fix that. If we have a demographic error, we can fix that.
What's that?
Say we have the wrong street. Say you live on Mike Lounge Drive and we have Mike Lounge Street.
Okay.
We can fix that. We can fix coordination of benefits. So say you have insurance and your husband has insurance and you have kids, and we, accidentally chose whichever policy that was primary for them wrong, we can correct that and we send it. We can fix coding questions and we can correct duplicate claims. So many issues can be resolved if we know about them, and the key is contacting us early.
Okay. What options are available? Okay, we already talked about that.
It's okay.
So what is one billing myth you'd like to clear up?
Well, I started to say it. I think the biggest one is that hospitals only care about collecting money. The truth is we're here for our community. Billing is simply one part of keeping the hospital financially healthy so we can continue providing high quality care for our community.
Yeah, and I'm glad you brought that up because I know it's just money, it causes problems everywhere all the time because some people have a lot, some people don't. But I'm glad you said that because we want our patients to know that we got to keep the doors open so that we can provide great care. And so it's not because we want money, it's because it's just part of the cycle of healthcare. Money comes in, care goes out.
Yeah, and the money that comes in is usually most often used to treat further care that's going out. So I think if patients bear that in mind, it's not just exactly that we need your money, but it's like we need you to pay your bill so that the next person who's hurt or needs care, we're available to help them as well.
Right, so we can pay the salaries of our employees and just everything that goes into what a hospital requires to keep the doors open every day.
It's a lot.
I can't remember the exact amount, but it is a lot of money needed for one day of operation of the hospital.
Yeah.
What's one thing every patient can do to help make sure the billing process goes more smoothly?
I would say, and I can't say it enough, is come prepared. Bring your identification, current insurance cards, referrals if needed, and let us know immediately if anything has changed. The girls downstairs are just doing their job, and I know, we know you. You're our neighbors. You're in our community. We love you, but that's why we ask for your information, because we want to get it right for you. That's the reason why we're asking. And then those few minutes during registration make a tremendous difference in getting to the point where everything is accurate, and then we don't have to keep asking.
What are you most excited about to improve for our patients?
More than anything, I'm excited to improve the overall registration and billing experience for our patients. We've already made important changes, including partnering with a new patient statement vendor, because we had heard the concerns from our community. In the past, some patients experienced significant delays receiving their statements, and that's frustrating for everyone. We know trust is earned, and restoring that trust is one of my top priorities. I want every patient to feel respected, informed, and supported from the moment they register until that final balance is resolved. That's the experience our community deserves, and I'm excited to help work on delivering that.
Yeah. So I'm going to kind of rewind the clock here and go back to the beginning of the show and just ask about you, because I know you're not from Carson County and that you also have more of a history in healthcare than just billing. So tell us a little bit more about yourself. So, let's let our public get to know you so we can build some trust here. So tell us, who is Danielle?
Hey, so Danielle grew up in Salt Lake City, Utah, the daughter of healthcare professionals. Come from quite a big healthcare background. Has always been a foundation in my life. Went to school, studied nursing, got a BSN in nursing. Didn't take the boards, decided that she wanted to step off into a master's program that was different. Billing had always been something that I did to feed my family. It was my job while I was going to school. It was what paid my bills. And then it's just one of those things that you just start to love it, and then when you try to get away from it, you just can't. And I think it's just, it's really funny too, because in high school I had to have a math tutor, and now I'm the director of revenue cycle. My dad always jokes with me, do they know who's handling their money? And I'm like, listen, that was high school. I've come up from that.
Yes.
But no, it's just something that, and I think that I kind of found my niche in where I could make a difference for patients.
Oh, I love that.
If I decided I wasn't going to be a nurse and I wasn't going to be delivering care, the best thing that I could do would be to make sure that every other aspect of their bill is taken care of so that they can just concentrate on getting better.
And I love that because there's so many people in healthcare, especially here in Carson County Memorial Hospital, that are not exactly patient-facing, providing care, but are part of the whole care process.
Yeah.
And making the care environment better. If I, have a bad day, end up with one of my kids in the ER, I don't want to be mad about it in 3 weeks when I get some bill I don't understand. That, I think that leaves a bad taste that kind of erodes the great care that we received here. So fixing that helps increase or improve the whole customer experience, right?
Exactly. And I think too, a lot of patients are going through so much in their lives. They're sick. They don't feel good. Some of them don't even know if they're going to make it. And I think the last thing that you should have to worry about at the end of the day when you're fighting for your life or trying to get your child to feel better or trying to just have yourself feel better should be, is this going to be paid for? Am I going to be able to pay my bill? Are they even going to bill right? Am I even going to get a statement? Those are things that should never have to cross your mind.
Yeah. So I'm going to ask you a tough question, and
Okay.
and you might not be able to answer it, but why has billing been so, I'm going to say bad? And I know not everybody's had a bad experience here, but we just have there's a big sentiment around here that billing is bad. But why has that been?
I think it's been an accumulation of a lot of things. I think it's been first the changing landscape of healthcare. You just get your feet underneath you, you introduce new services, you just learn how to bill them, and then things change. Mm-hmm. I think that insurance companies don't make it easy. They don't make it easy for us at all. It's a fight every day to get every penny that we get from them. I think that is difficult. I think too, I think it's hard to live in a small community and to interact with the people at the front desk at the grocery store and stuff, and then to have them say, I need your insurance. It's got to be frustrating. I mean, you know who I am. I'm your mailman, and
Yeah.
So I think that complicates things. And then I think too, just training needs to be given, and it needs to be consecutive, and it needs to be followed through consecutively. And so while we have trained our staff and they're excellent, I think that training needed to be something that was ongoing to support the change in that landscape. And so I think that these are all things that we just, we've learned. Like I said, I've done this for 30 years. And so you do it and then you learn some more and then you want to do it better. And then you do it again and you learn some more and you want to do it better. And so I think it's just reaching a place where you finally say, we're getting ready to have a new EMR. We've got this new statement company. The hospital's growing. We're seeing more patients, and we need to be able to not only compete with our competitors, but we need to have an edge. And so I think all of those things make you pivot and say, okay, so what do we need to fix to get this working right? And then I think it helps sometimes too to have like the viewpoint of somebody from the outside. I mean, I didn't grow up here. I grew up in Salt Lake and worked for major healthcare companies where I can bring a little bit of that knowledge from the outside that kind of gives us another pivoted perspective. And so I think we're just at a time where things are growing, things are changing, healthcare's changing, and money's hard, and people want to hang on to their money, and people want to make sure they're paying their bill right, because I pay, this might be the difference between my light bill or my hospital bill. And so I think the way the economy is and things, people just want to make sure it's right. We want to make sure it's right. And it's just, we're at that time. I think the time has come.
Yeah. And so in your, decades of healthcare finance experience, it's political too, right? Like
Very.
How much Medicaid gets paid or Medicare, and does that factor into your job as well?
Yes. And Medicare is constantly changing how much they're paying for things. Medicaid, I mean, sometimes in some cases, like you'll deliver a service and you won't even get paid what it cost us to deliver the service. On the back of that, there's always then you get paid a little more for things. And so the idea that it evens out in the wash, you know what I mean? But I think just the cost to deliver healthcare too. I mean, we need to make sure that we're doing it right, not only for our patients and for them, but also for ourselves. Because if we're leaving money on the table, there's things we could be billing for that we're not. We're cheating ourselves. So I think just that knowledge and wanting to make sure that we're doing it right for patients, we're doing it right for ourselves, and we're staying up with what we can bill for, so that we can provide more care.
Right. Yeah, and I mean, just like any household, we have to make sure that there's money in the savings account too, right? Like for some unforeseen thing, like a heating unit goes out, we have to be able to pay for that too. Mm-hmm. So we have to make sure that we take care of our health service district through accurate billing.
Correct. It's vital.
Okay, so I know that billing it's a matter of importance to the hospital board, and that they really want it to be improved because they know it's been a point of contention in the community. So they've put it on our CEO to improve that, and he's put it on his CFO. Like how much of this weight are you feeling in, Danielle, you need to fix billing here?
A lot. But it's what I'm here for, and I'm up to the challenge. And I think, healthcare can feel overwhelming, especially when it comes to insurance and billing. My promise to our community is that we're committed to making the process clearer, more compassionate, and easier to navigate. If you have questions, please reach out, and we're here to help. I think, I can't say that enough. We're here to help you. We want to resolve this. And I think that that I'm excited to deliver my ideas to my staff, to do this training with them, to get them up to speed, and then just to watch how great everything is.
Yeah. So for our listeners, remember just one thing from today's conversation about billing. What would you want it to be?
It's not as hard as it seems, and there are people there to help you navigate it. You're not alone. If you don't understand how to read your explanation, you don't understand what your hospital statement's saying, in no way whatsoever do you have to deal with that alone. We're here. You have a team of people that are right through those doors that can help you, are willing to help you, and would be glad to help you at any time.
No, because maybe it hasn't felt like that before.
Yeah.
But it does now?
Yes, yes, you have my word.
Okay. Well, thank you so much for taking the time to talk to us about billing, because like I said, it's frustrating, and not just here, everywhere. It's a complex animal that we just have to navigate when we need healthcare services, right?
Correct. But don't ever let it be a barrier for why you don't get healthcare services.
Absolutely. Yeah, if you need help, come and get it.
Correct.
We will take care of you.
We promise.
Yes. Okay, community, I guess my ask of you is that you give us a chance. There are a lot of great things coming up for Carson County Memorial Hospital Health Service District. We have a lot of exciting things, a growth of facility, staff, providers, services. We're going to have some growing pains, but with that, we ask that you give us a chance, and we are doing everything we can to improve billing, and we ask you to trust us. And if you feel like that trust has been broken, come and talk to Danielle, and she's going to do her very best to make sure that you're feeling good about your bill.
For sure.
Yeah. All right. Thank you for joining us, Danielle.
You're welcome. It was so great. Thank you.
See you next time.
Okay.